Welcome everyone. This is Albert. We are going to be continuing with our, cancer education, and today we'll be talking about the signs and symptoms of prostate cancer. My last video was about the risk factors. Abusianfo yeshesha bio abetini. Videos on my mix English and Twi nti pacho say problem with brofuna Twi version or nti yasone time na yensua de. So signs and symptoms of prostate cancer. Mostly a lot of these symptoms are urinary issues, and it's because the prostate sits between your rectum and your bladder. So a lot of the symptoms you would see are mostly urinary issues. So first and foremost, first symptoms is frequent urination, especially waking up at night too often to go pee. Nocturia, that is the terminology here. When you wake up more often in the night to go pee, means there is something wrong. Weak, slow, uninterrupted flow. You go to the bathroom and you're peeing, but it's coming slowly, and the flow is weak and cannot stop. That is a symptom. And also when you go to the bathroom and you're having difficulty starting to pee, you hold your penis, and it takes a while before the flow starts, and once it starts, it's difficult to stop. That is a symptom. And also feeling all of a sudden you feel like you need to go pee, having the urgency to go pee more often is a symptom. And also incomplete emptying of the bladder. When you go to the bathroom and you feel like you're done peeing, but as soon as you come out you feel like, okay, your bladder is not completely empty, but then you can't really pass pee again. That is also a symptom. Other potential symptoms include pain in the pelvic area, like your pain in the hips, pain in the lower back, just a general pain in the pelvic area. It's a symptom. And also pain during urination, dysuria. That is a potential symptom. Sexual dysfunction, having difficulty maintaining erection, is a potential symptom of prostate cancer. And also when you have pain during ejaculation, it's a potential symptom of prostate cancer. But what I wanna make clear here is that most of these urinary issues are more commonly caused by what we call the benign prostate hyperplasia, which is called prostate enlargement. Most of the urinary issues are commonly caused by that, because as you age, the prostate enlarge, and once it enlarges, it exerts pressure on your bladder. So as soon as you have a little pee in your bladder, it feels like you need to go pee. But the issue is that you can't really tell whether it's a prostate enlargement or it's a prostate cancer. So the most important thing is when you see these symptoms, you need to consult your doctor, and then you start the screening. So prostate enlargement and prostate cancer have the same urinary issues. The same urinary issues that I mentioned, you will see that. But there is difference between prostate enlargement and prostate cancer. When your prostate enlarges, doesn't mean you have prostate cancer. No, it's a non-cancerous, it's benign, but you would have to talk to your doctor, before, and then, you would need to be diagnosed to establish that it's a prostate enlargement and not a prostate cancer. Abusiamfo nti and then I say signs and symptoms of prostate cancer. The can say nyane anajo intentem anajo say when nyane be 3, 4, 5 times to na uko junso a sign of prostate cancer. And na bruni a friend in nocturia. Say uko junso so na junso no a banket na so eno a intimi nyai, na very weak and so song kitten no one of the signs na ujunson so a ukwa dware a wo so be man mu a ubre ansa na junson na hyase nso a usan bre ansa na stop it eno a wo be hyase no mantem e ban so a so song kakra usan bre ansa na jai a sign and symptom of prostate cancer. And sign and the twaso necessary say debiano umwane was so kokojunso umwane was so kokojunso we feel it urgent so umwa krane was so kokojunso and no see a symptom and now kokojunso so a wojunso awie and so na I say unjunso nwie na still I feel say junso edaso ejina oblada no a symptom nti we nyina no junso mu issues but the tiane say yewo prostate enlargement the bruni friend of benign prostate hyperplasia prostate enlargement and prostate cancer. But the symptoms and then the signs ni nyina no the same as prostate cancer. Inti the mabubo so nyina no ebetimi aba ne say o prostate na kese but enye cancer but untimi hu say cancer na say o prostate na kese. Inti the here ne say ubekwa ko hu o doctor na ya diagnose you ne ya ka say okay enye prostate cancer but o prostate na kese because bema bia unyini after 50 years or they con o prostate automatically kese but kese enkyere say prostate cancer no nti munhye eno no nso but symptoms no any prostate cancer symptoms no the same nti dia maybe boss nyina no say who experience bia kona ko hu doctor dia twaso bio sign of prostate cancer say junso every ubema no mu eba the broni friend hematuria no junso ewo your friend say moja ewo junso na say semen mu hematuria moja ewo junso mu bacho unshare no nso and I say wo ya obi ewo wechi the baby abroni be friend no pelvis or hips say sisi any pain ya obi ewo sisi area obia no a sign and symptom but untimi nkyere until say obehu doctor ebi nso say obema intimi enyina so it might not necessarily mean say a cancer but a symptom of sign and symptom obema intimi enyina so a niama bebre na deba but and also can sign and symptoms of prostate cancer no ho and say wo ho so ba na o tiaw hu ba na o tiaw a sign of prostate cancer nti abusuanfo there may be both signs and symptoms of prostate cancer, especially the Jones or Hono, and also a bit me about say o prostate na kese but only prostate cancer. Inti say who experience any of these symptoms, especially bema be already 45 for young before di 45 hodi kwa pacho shall say na di o prostate health with your doctor. And I say who shall say who have problems with my own doctor and kesa. As I always say, no one want to be told, you know, you have cancer, but it's better to be told early than to be told late. So if you're experiencing any of these signs and symptoms that I just talked about, please talk to your doctor. Hear the bad news early than to hear the bad news late. Cancer is like any other illness. Once you diagnose early, you know you have more chances of survival. In for a video need basi here. So when you follow me and patch up on go follow me na my next video will be talking about prostate cancer screening. Watch out. Peace.